what can cause blocked tubes? Blocked tubes can be caused by many things. I'll list off some things that can block your tubes. Endometriosis. If somebody has had PID, pelvic inflammatory disease, particularly with chlamydia, this is a common cause of tubal factor infertility or blocked tubes. And the more times somebody is infected with chlamydia, particularly if it goes from just being like a localized infection in the cervix to a full pelvic infection, that has an increasingly higher likelihood of being related to infertility. You can have blocked tubes that are just genetic. The way that your tubes form was just not how they were supposed to. If you've had like a ruptured appendix or any other kinds of pelvic infections or abdominal infections, you can get scarring and scar tissue that blocks them. All manner of things can cause the tube to block. Previous ectopic pregnancies would scar the tubes down. Lots of things can cause tubes to be blocked. If you don't want kids and don't ever try to conceive, would you ever know your tubes are blocked? Probably not. I was under the impression there's nothing that can be done about tubal occlusion. Yeah, so a lot of times there's not, because many of the things that cause tubal occlusion are scarring inside the inside of the tube. And if you try to fix that, the tubes are very delicate, and most of the time you're going to end up not being able to undo that, or putting someone at such a high risk for an ectopic pregnancy that it's not even worth it. But in some scenarios, for instance, if I see that the tube is, there's scar tissue or adhesions all around the tube and it's blocked, I can sometimes manipulate that and take it down and end up being able to help it. But in a lot of situations, there is not anything that you can fix with a blocked tube. And when you live somewhere like New Zealand, for example, I live here, obviously, and the National Health Service provides access to in vitro fertilization for certain people who qualify. Then if you have tubes that are blocked, it's best to just take them out, because that would mean you automatically qualify for in vitro fertilization. And that's a conversation we have with the patient before we do that procedure, is like, if the tubes are blocked, what should we do about them? Because when they are blocked, there can also be an association with an increased risk of not getting pregnant even through IVF, because the tubes can create, via what we call hydrosalpinx, where they fill up with a bit of fluid, a kind of cytotoxic or cellular toxic fluid that can decrease the chances of implantation. So a lot of times you will just take them out, particularly if they have what we call hydrosalpinx, where they're filled with fluid, in order to improve the chances of success with the procedure. No bypass like a blocked artery. Yeah, I mean, in this situation, the bypass is IVF. You bypass the tubes by not requiring them to do the job that they're not doing. And again, the reason is because, sure, you could cannulate the tube with putting something in it, but anytime you're doing that, the embryo then is still going to have to pass through that, right? So you're putting the embryo at risk of either implanting there and causing an ectopic pregnancy, which is dangerous, or of, getting damaged going through there, or having inflammatory markers that are, decreasing the chances of it implanting in the uterus. So the bypass in this situation is IVF.